My name is Dr. Joseph Bavaria. I'm a cardiothoracic surgeon who has spent over 20 years inside operating rooms, holding beating hearts in my hands, sometimes saving them, sometimes losing the race against time. Today, I want to talk to you about something that affects millions around the world, but is still misunderstood by many: the heart attack. We often think heart attacks are sudden and unpreventable, a bolt from the blue. But here's the truth: a heart attack is a warning that came too late. If you understand how it begins, you can stop it before it ever strikes. What is a heart attack? A heart attack, also known as a myocardial infarction, occurs when the blood flow to a part of the heart is blocked. The heart, like any other muscle in the body, needs oxygen to function. It receives oxygen-rich blood through coronary arteries. If one of these arteries becomes blocked, the part of the heart it supplies starts to die. It's not the heart that fails first, it's the blood flow. And what blocks the blood flow? Most commonly, it's a clot formed on top of a ruptured plaque, a buildup of cholesterol and inflammatory cells in the arteries. This condition is called coronary artery disease, and it's the root cause of most heart attacks. Causes of heart attack: more than just cholesterol. A heart attack doesn't happen overnight. It's the result of years of silent, internal damage that many people aren't even aware of. Let's break down the real culprits behind a heart attack. Number 1, atherosclerosis, the silent saboteur. Atherosclerosis is the buildup of plaque, fat, cholesterol, calcium, and inflammatory cells on the inner walls of arteries. Over time, this narrows the arteries and reduces blood flow to the heart muscle, the real danger. When this plaque ruptures, the body responds by forming a blood clot, which can fully block the artery, leading to a heart attack. Number 2, high blood pressure, the artery killer. Constant high pressure damages the endothelial lining, the inner wall of blood vessels. This makes it easier for cholesterol and cells to stick, worsening plaque buildup. Damaged vessels are more prone to rupture and clot formation. Number 3, high LDL cholesterol, the sticky threat. LDL, bad cholesterol, is one of the major contributors to plaque. When too much LDL circulates in the blood, it gets trapped in damaged arteries, feeding atherosclerosis. Number 4, diabetes, the accelerant. High blood sugar levels damage blood vessel linings and promote inflammation. Diabetics often have a higher presence of smaller, denser LDL particles, which are more dangerous. It also impairs the body's ability to repair arterial damage. Number 5, smoking, oxygen deprivation, and artery stiffening. Smoking causes the blood to carry less oxygen to the heart. It increases clotting factors and inflammatory responses in the arteries. Smokers' arteries become stiff and narrow, dramatically increasing heart attack risk. Number 6, obesity, beyond just weight. Obesity brings metabolic inflammation. Fat tissue secretes harmful chemicals, cytokines, that damage arteries. It's also linked to high blood pressure, diabetes, and cholesterol, creating a perfect storm. Number 7, chronic stress, invisible trigger. Stress hormones like cortisol and adrenaline raise heart rate and blood pressure. They cause artery walls to constrict and may destabilize vulnerable plaques, triggering rupture and clot. Number 8, lack of physical activity, slow circulation. Inactivity leads to poor circulation, insulin resistance, and obesity. Regular movement boosts vascular health and keeps arteries flexible. Number 9, genetic predisposition, the inherited risk. If you have a family history of early heart disease, your risk is elevated, even with a healthy lifestyle. Genes can affect how your body processes cholesterol, fat, and inflammation. Perhaps the most shocking fact: over 50% of heart attack deaths occur in people with no prior symptoms. These people were walking around with silent blockages, unaware that their hearts were already under siege. That's why regular screenings, healthy habits, and awareness are essential, not just for the elderly, but for everyone over 30. Symptoms of a heart attack: classic and silent. We've seen it in movies, someone clutching their chest and collapsing. But in real life, symptoms can be subtle, especially in women and diabetics. Here are the classic symptoms: chest pain or discomfort, pressure, tightness, or squeezing in the center or left side of the chest. It may last a few minutes or go away and come back. Shortness of breath, especially with exertion or at rest. Pain in the left arm, shoulder, neck, jaw, or back, sweating, cold sweat, clammy skin. Nausea or vomiting, dizziness or lightheadedness. Extreme fatigue. But there's also something called a silent heart attack. It happens without typical chest pain and is more common in people with diabetes, older adults, and women. They might just feel unusually tired, a bit short of breath, or slightly nauseated. If you ever feel like something isn't right, don't ignore it. Early warning signs days or weeks before. Most people don't realize that the heart gives subtle warnings days, even weeks, before a major attack. Some early signs include discomfort in chest with exertion, climbing stairs, walking uphill, mild chest heaviness after meals or stress. Shortness of breath that's new. Sudden fatigue even without physical activity, unexplained anxiety or restlessness. Swelling in ankles or feet. Snoring or sleep apnea. Often people dismiss these signs as aging, stress, or indigestion, but a good rule? If something changes suddenly, pay attention. How a heart attack happens, minute by minute. Let me walk you through a heart attack from the inside. A small cholesterol plaque in a coronary artery ruptures. The body responds by forming a clot, thinking it's helping. The clot completely blocks the artery. Within minutes, oxygen stops reaching part of the heart. Heart cells begin to die. Damage begins immediately. After 20 to 40 minutes, permanent muscle damage starts. If untreated within 1 to 2 hours, the damage becomes massive, sometimes fatal. That's why we say, time is muscle. The sooner we open the blocked artery, via medication or surgery, the more of the heart we can save. Emergency response. What to do during a suspected heart attack. If you or someone around you might be having a heart attack, call emergency services immediately. Chew and swallow an aspirin, unless allergic. Stay calm and seated or lie down. Do not drive yourself. If the person is unresponsive and not breathing, start CPR. In hospitals, we use medications called thrombolytics, clot busters, or perform an emergency angioplasty to reopen the artery. Seconds matter. The longer you wait, the more damage occurs. Diagnosis and medical tests for heart disease. Even if you're not having symptoms, you should know your heart's health. Here's how doctors check for risk. Electrocardiogram, ECG, checks heart rhythm. Echocardiogram, ultrasound to see heart function. Stress test, shows how the heart performs under exertion. Coronary angiography, checks for artery blockages. Blood tests, to check for markers like troponin, cholesterol, blood sugar. Don't wait for a heart attack to find out your risk. Treatment options after a heart attack. If someone has already had a heart attack, we tailor treatment based on severity. Acute phase, during attack. Clot-dissolving drugs. Coronary angioplasty with stenting. Coronary artery bypass surgery, CIBG, chronic phase, long-term. Medications like beta blockers, statins, ACE inhibitors. Lifestyle changes, exercise, diet, smoking cessation. Cardiac rehab, supervised physical and emotional recovery. Regular follow-ups with a cardiologist. Heart disease is not a death sentence. With treatment, people can live full lives. Preventing a heart attack, the surgeon's checklist. What if I told you that 80% of heart attacks are preventable? Here's the surgeon's prevention list. Know your numbers. Blood pressure, 120/80ths, LDL cholesterol, 100 milligrams per deciliter. Blood sugar, normal fasting levels. BMI, under 25. Quit smoking permanently. Eat a heart-healthy diet. More vegetables, fiber, lean proteins, less sugar, salt, red meat. Exercise 150 minutes, week, walking, swimming, cycling. Sleep well, 7 to 8 hours per night. Manage stress, meditation, breathing, support groups. Stay connected. Social isolation is a risk factor. Regular checkups, even if you feel fine. If your car gets a checkup every 6 months, shouldn't your heart deserve the same? If your car gets a checkup every 6 months, shouldn't your heart deserve the same? Final message. Listen to your heart, literally. I've stood beside patients as they begged for one more chance after ignoring early symptoms. I've also seen patients walk away stronger because they caught it early. The heart doesn't just pump blood, it whispers signs before it screams. Listen. A heart attack doesn't have to end your life. With awareness, it could be the start of a healthier one. If this video helped you understand your heart better, subscribe to this channel. Let's spread awareness, save lives, and protect the beat that keeps us going.